Thank you for joining us for this Advent Health virtual seminar. We hope you'll find the material presented helpful and informative.
My name is Amit Tandon. I'm the Medical Director of Interventional Pulmonology at Advent Health Wesley Chapel. Today we're going to be discussing lung cancer screening and how it pertains to our patients. So when we talk about any sort of cancer screening, we're going to discuss how we got here, why we're here, and what we need to do to prevent cancer. So we have the screening for breast cancer and colon cancer, which has been approved by the U.S. Preventive Task Force. And now, since 2013, they have approved the lung cancer screening after the national lung screening trial that was completed in 2011. We will discuss more details about this trial in the upcoming slides. Now, what is lung cancer screening and why do we want to do this? So we want to evaluate for lung cancer and lung nodules before symptoms appear. And as we'll see in the next couple of slides, symptoms do not appear until later in the disease. It also helps us diagnose the lung cancer at earlier stages. So when we talk about lung cancer screening, we want to also evaluate for who qualifies for these screening CT scans. Now, we have patients that the U.S. Preventive Task Force has evaluated from the different trials that have been done, including the national screening trial, the ages between 50 and 80, males and females. Those that have smoked 20 years, at least one pack per day per year. Now, that can get a little bit confusing. So if you've smoked for 20 years, and each of those years you've smoked a pack per day for those 20 years, and then patients that are currently smoking or have quit smoking in the past 15 years all qualify for the lung cancer screening at this time. Now, these numbers are fluid, and new studies and new data are coming out every day. So the U.S. Preventive Task Force is updating their website as well as their providers with the current guidelines. So how is lung cancer screening done? Is a chest x-ray good enough? Now, we've evaluated with the lung screening trial that in 2011, which was published in the New England Journal of Medicine, completed over 50,000 patients, which evaluated chest x-rays versus CT scans. Now, chest x-rays are seen here on the left-hand part of the screen. This is a plain film of a patient that was done for shortness of breath. And then this went on to get a screening CT scan, which is seen on the right side of the screen. You can see the red circle shows a lung nodule, which was found on the CT scan, but will be difficult to see on the chest x-ray, given the structures in the center of the chest, which can obscure these nodules, especially if they're so small, and in this case, it was 4 to 5 millimeters. So how do we do a low-dose CT? So this low-dose CT is done within 7 to 15 seconds, and it's captured the entire chest within a single breath hold. Now, this is important because a lot of our patients are with chronic pulmonary diseases such as COPD, emphysema, or chronic bronchitis, and it's difficult for them to hold their breath to do a CT scan. Now, this being a CT scan that's done within 7 to 15 seconds also helps our patients that are claustrophobic. Now, MRIs can take up to 45 minutes, and this CT scan takes only 7 to 15 seconds. The radiation dose is very low. It's 1/10 of a regular CT scan, and this test is available at Advent Health Wesley Chapel. So talk to your provider about getting this test scheduled if you do qualify. So why do we do lung cancer screening? Now, this slide is a little bit busy, but you can see the different data points and pictures, and we'll go through this a little bit. So lung cancer is the #1 killer in the United States. The most recent data from 2020 is pictured here on the right side. For males and females, it's about 23%, 22% respectively, and the incidence is increasing in females. Now, the other data point that's here on the left-hand side is the stage at diagnosis. So 50 to 60% of patients will have metastasis or spread at the time of diagnosis. Now, we look at that and take it into account for the 5-year survival. At stage 1, if you're to be diagnosed, your survival rate is 75% or higher at 5 years. Now, at stage 4, your survival rate goes down to 10% or less. The national lung screening trial showed a reduction in mortality over a 6-year period of 20%. We needed 320 screens to prevent 1 death. And this also showed that patients that were diagnosed with lung cancer were diagnosed 60% of the time at stage 1. Common questions we typically get as providers after the CT scan is completed. My CT scan now shows a nodule. Now what? So what is a nodule? Do I need a biopsy or surgery? Do I have cancer? So what are the different causes of nodules? Nodules can range for a variety of reasons. Here we see just categories of lung nodules. Now, there are subcategories in each of these categories. They can range from congenital disease or development issues in utero to infection, which could be post-infection or ongoing infection, cancer, fluid within the lung, and also tortuous blood vessels. Scar tissue can also develop after infections or exposures to environmental elements. So here we have a few various nodules that we've picked up during lung cancer screening CTs. We'll go from left to right. On the left-hand side, we see a lung nodule, which turned out to be infection. On the right two pictures, we'll start with the one in the middle. We see a nodule on the left-hand part of the screen, which is actually the patient's right lung. And on the right-hand side, we see a nodule in the right half of the screen, which is actually the patient's left lung. Now, these nodules on the right-hand side need to be watched a little bit closer as they are smaller and increased risk in biopsying at this time. But when we find these nodules, you have access to a pulmonologist, a surgeon, an oncologist, and a radiologist right off the bat. So we have a conference every other week at this time to go over new patients that we see in clinic, as well as new patients that come up with lung nodules on our screening CTs. So this multidisciplinary conference will allow us to discuss patients that we see in clinic or see on CT scan, and then get back to that patient with the plan, whether we're going to follow that CT scan with a subsequent CT scan in 3 to 6 months, whether we need to go for a biopsy this time, whether that patient needs to go to surgery or straight to radiation if that patient is too high risk to undergo any of these procedures or anesthesia. Now, we talked about symptoms with lung cancer. Again, as I mentioned before, these symptoms are usually seen at later stages of the lung cancer. Lung nodules themselves do not typically cause these symptoms unless they're compressing airways or blood vessels at the time of diagnosis. Some of these symptoms that you might see are cough with or without sputum or blood, shortness of breath, recurrent pneumonias if there's any sort of obstruction due to the lung nodule or lung cancer, chest pain if it starts to involve the outside parts of the lung or the pleura, weight loss, or hoarseness in your voice if you start to have involvement of the lung cancer within the center portions of your chest, which contain nerves that control the vocal cords. So the number one question we typically get is, what can I do to prevent lung cancer? So when you talk to any provider, the number one measure we're going to recommend is to quit smoking. Now, in speaking with your healthcare provider, we have different smoking cessation methods, such as nicotine replacement, smoking cessation classes and courses, as well as medications that we can prescribe for patients to help cessation. Now, also talk to your provider about lung cancer screening. We discussed a lot of points here, and it's going to be important to see if you fall into these categories. If you're an active smoker at all, discuss this with your provider and if you qualify for lung cancer screening. Now, most insurance companies will pay for the lung cancer screening, as this has been approved by the U.S. Preventative Task Force and in place for lung cancer screening at this time.